Okay, now we're going to be talking about how spinal degeneration can be the cause of your health problems. And before I get started, I want to go over this quick analogy of traffic. If you look here, you can see when you have traffic or you have an accident, everything gets bound up. So if you're on the highway and you get 4 lanes going down to 2 lanes, you know that everything gets bound up and things don't flow. So I want you to take that analogy and look at the nervous system the same way. What we're looking at is what spinal degeneration looks like on your insides. So these people had passed away, obviously, and then they were cut in half. And then now we can look at what the spinal degeneration, the compression of the spine looks like. So if you notice right here, you have like in the last video, you have bone, 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 and then you have this loss of space here, and then bone and bone. And right at this loss of space, you can see that there's a blockage here. So picture this as your central artery or your highway going down the road. And then you're going from 4 lanes, and now you're going to 2 lanes right here as you go through. At this level, there's a blockage, and that blockage disrupts the pattern, disrupts the flow of the central nervous system. And remember, the central nervous system controls everything in the human body. So where degeneration in your knee or osteoarthritis in your knee just affects your knee, when you have degeneration of the spine, you're actually affecting the way the body functions. Now, this is only one level. When you come over here and you see multiple levels, look at that. Look at the way your spine in there is getting significantly compressed. You don't have one accident in your highway, you have 1, 2, 3, and you're getting severe compromise of the central nervous system. Now, this patient here, they would have more symptomatology. They'd have heart issues, they'd have breathing issues, they'd have digestion issues, and nobody would be attributing that lack of balance or that body being out of balance to spinal degeneration. But I mean, you can see this is a healthy nerve other than this point right here. But as you look here, you can see the severe compromise. And then if you let it go even further, you get severe atrophy of the central nervous system. Think about that. You have atrophy of the system that is controlling your entire body. And that's due to spinal degeneration, which is preventable. So as we go to our next slide, the nervous system, just like the fuse panel, I know it's a little difficult to see, but you can enlarge the picture below. But every nerve goes to a specific area, just like every road in your town goes to a specific area, a road or a junction or a house. Every nerve is mapped. C5 and C6, the reason why that's important, that goes directly to your thyroid gland. So most people that come into our office that have thyroid issues have degeneration at that level. Somebody that has stomach issues, they a lot of times have degeneration at that back level, or they have muscle spasms in that area. Then you have digestion issues. So everything is mapped. So now you can start to get to see how everything is connected. Hopefully this series is bringing or shedding some light as to why you're sick, and getting some explanations of why you can't tend to get to the cause of the problem. Because, the analogy is, if I'm watering a garden, stepping on the garden hose, is that garden ever going to be able to flourish? And the answer is no. And that's the same thing in the central nervous system. If you are living a life with spinal compression or spinal degeneration, chiropractors call that subluxation, then you are living a life not up to your potential due to your structure. Your structure equals your function.